Hi, everybody. Rob Morgan, Chief Medical Officer for Let's Get Checked, and happy to be joined today by one of our superstars at Let's Get Checked, Kristen OConnor, who I will introduce in a moment, except just put a personal spin on this, that Kristen has been one of the people at Let's Get Checked that I have worked with the longest and have enjoyed working with tremendously. So it's really fun to have Kristen along for today's conversation. And maybe we'll just start there. Kristen, tell us a little bit about yourself. You're a nurse, so tell us about your background, what that means, and then we can segue into a little bit about how that's played in here at Let's Get Checked.
Absolutely. Happy to be here. Thanks for having me. So my background, I started out in a cardiac ICU step-down unit, only worked in hospital settings up until this position on night shift. So those lovely 12-hour shifts. I then journeyed into labor and delivery. And then I moved to New York City, and I was looking for something that could kind of bridge the, excitement of being in this city. There's a lot of med tech going on. So I came across this posting, and I was like, this is exactly what I'm looking for. Not your traditional clinical setting, but something that just seemed very exciting and kind of where healthcare is going right now.
That's great. And so you joined the team when?
The beginning of 2018. So I was one of the first 2 nurses in the US when we first kind of branched out into the clinical setting in the US. So it's been very exciting to be able to help kind of curate this clinical team that we have. It's been a great, amazing process.
Yeah, it's been fun to see it grow. And I think, it's interesting that as Let's Get Checked has evolved, one of the things, of the many things that I'm really proud of, but I think really differentiates us is that, with our clinical team led by you and some of our other nurses, we now have the ability to create real support for the clients that would be using our services. So we're more than just a lab test, I like to say. It's one thing to just get a result, but it's really trying to provide some of the guidance around that. And that's where you have been really instrumental, correct?
Absolutely. At the end of the day, we're nurses and we advocate for our patients. That's, why we all started this journey. And to be able to touch on those points and not only have conversations with the patients of how they got to us, their journey to finding Let's Get Checked and testing, but then also help guiding them on what their results could indicate, and absolutely making sure they follow up with their physician and guiding that process too. We really have the unique opportunity to provide the clients with the customers with education and make sure that they have the resources and the tools they need in their lab reports to follow up with their doctor.
And that education, I presume, can happen across the wide spectrum of lab panels that we offer. In other words, it's not that you only support results in one avenue, but really if one goes and finds all the tests that we do, there are clinical clinical factoids that are really important probably for each and every one of those. Is that correct?
Absolutely. The nursing team that we have right now, we all come from a very different clinical background. So it's really nice that we can support not only our wellness tests, our sexual health tests, now of course COVID tests and that experience with those new tests. So yeah, across all the tests that we offer, we definitely support with everyone. A customer can come to us at any time in the process before they take their test, help guidance on choosing a test, during the actual sampling process, and then absolutely afterwards, so you can help guide them on what the results could indicate.
And do you find in those interactions that the client is typically looking for, reassurance? Are they often in really dire straits? Is it sort of across the board, or what's your sense of what their sense is or where they're coming from?
I think it's across the board. You're going to get people who have, they're not feeling well. They have symptoms. So they're going and they're on a journey of, what's making me feel this way that I'm feeling. They go to their physician runs a couple tests, but they want to do more. I think we get people who are just absolutely curious. They haven't checked their cholesterol in years and they want to start on this wellness journey. So they're coming to us to do those tests. You have people who are coming to us because they're having symptoms and they're nervous and they're scared and they're looking for some sort of validation or, why they're feeling this way. They're looking for a nurse to help take them through that process and give them advice.
Yeah, that's awesome. And again, I think it really does differentiate Let's Get Checked from really from just anything else in the market that I'm aware of. I've felt for a long time, and it's one of the reasons I've been so excited about the company and the direction we've been in is, while we know that we have, excellent lab services, and our high complexity CLIA lab is really just gold standard, top of the curve, et cetera. But to be able to pair that with the ability to get the kind of support and education and knowledge is amazing. To that end, you mentioned that sometimes people will come to you before we even get to the results part, right? So they get a kit in the mail, and depending on what the lab test is, right, there's different collection parameters. So depending, some of our tests obviously require a urine specimen. Others might require a finger stick for blood, or certainly in the case of COVID, a nasal swab, lower nasal swab. So can you talk through maybe some of the common questions that you and the rest of the nursing team might sort of field in terms of what you sort of hear, if there's common themes, and maybe some advice you've given around some of the tests in terms of good ways to collect them or pitfalls to avoid?
Yeah, absolutely. So I think, this sort of blood collection can be different for people. They've never done this before. Unless they're diabetic, they're not necessarily used to doing a finger stick. That being said, it's very user friendly, and we absolutely offer that support with the nursing to guide through the process. There's general tips. We have videos on the website. When we get a customer on the phone, we have general tips, making sure that, you've gotten up, you're moving around, you're well hydrated. Making you can massage from your elbow down through your wrist to really get that blood flowing in the fingertips. I think sometimes just having the conversation on the phone with the patient, walking them through the steps, they just feel much more confident in that process. And then, there will be times where a customer does it on their own and they're not successful. They get a result that's called quantity not sufficient. We absolutely give them the opportunity to do a test again, and we'll walk them through that process to make sure that they're successful.
That's a good point. I never think about that, but probably people worry that if they don't do it correctly, is it sort of a one and done kind of deal? And what I'm hearing from you, and certainly what I know, is that in fact is not the case. That we will support them, and if they need to do another test, we'll make sure we facilitate getting that done. Because at the end of the day, we really want them to have an actionable result that they can rely on.
Absolutely.
Sounds like you guys facilitate that.
And we always offer them the opportunity to get back on the phone with us. We'll walk them through the process. We have times where we actually are on the phone with them, and we really walk them through the process of filling up that vial. And they really appreciate that support.
Yeah, I'm sure they do. And that kind of support is available not just kind of 9 to 5, Monday to Friday, correct?
No, that support. So our customer support team can also help guide the process. There's videos and links that they can send, and that's 24/7.
Wow, that's pretty amazing. I guess I didn't even know that it went that far. So that's pretty awesome. One of the things that I know we do, and not only are doing, but are going to be expanding, which I'm really excited about, is we're actually able to provide therapy for some of the abnormal tests that might come up. And I'm thinking here specifically right now about around some of the sexually transmitted disease tests. As you're well aware, right, if a patient comes back with a positive chlamydia result, your team is able to offer prescription services around that.
Yeah, and I think that's also, we get a lot of customers coming to us for sexual health screenings because it's a kind of a one-stop shop. They come here, we give them guidance, we offer them a prescription to a pharmacy. It can be a mail order prescription sent directly to their home. It's completely anonymous service. So, and then of course, we follow up with them to ensure that their antibiotics are taken appropriately and to give them guidelines on retesting protocols. So from start to finish, we can offer a full service for that.
And cholesterol and all that. I imagine you get a fair amount of questions there too.
We do get a lot of those questions. A lot of people are, you have the spectrum of people who are on statins, and they're doing this as, their yearly checks to make sure that their dosing are fine. They take our lab report to their physician, who can then to prescribe different medication or up their dosage if needed. We get a lot of people who have never had a cholesterol panel. They're 40 years old, and they're not necessarily seeing a primary care physician. They're coming to us, and that's on their wellness journey of, what can we do with this information now? So we get a lot of people who are just doing wellness tests in general, getting a baseline, and then from there they can follow up with their doctor, determine, how often they should be testing, if they need medication. We have a lot of repeat customers who come to us for their yearly checks.
Yeah, I think it's such a great use of our offering, of our service. I mean, it's what I initially back in 2016 got excited about with Let's Get Checked, is the idea that people can get this information on the front end and then use that in their relationship, their ongoing relationship with their established physician. So that was kind of the original, like, wow, that would be really cool. But then I think about our motto, if you will, that it's good to know. I mean, I think it really is. And so when you can empower people to have access to that knowledge, but not just have access to it, but then to have the kind of support you and the nursing team can bring, I think that is really, really powerful. I was also thinking, as you go through some of the panels and stuff, and I think about sort of cool stories, one of the ones that I'm always intrigued by is with our bowel fit testing. And I know we've had some people where we have our testing has then ultimately led to them being discovered with early colon cancer, which is highly curable. So what a great opportunity, a great story there for those people. And I know you've seen that as well.
It's incredible. And they also want to call us back and tell us, like they're so thankful for this early screening that they were able to do. We see customers in, specifically in the EU that, they have to go off of NHS guidelines, and they're not necessarily getting this test as soon as they would like it if they have family history. And so they do the test and follow up with their physician and determine that, like they actually do have, early stage colon cancer. And if it wasn't for our test, then they wouldn't have known that. They wouldn't have detected that as soon as they did. It's incredible to hear these people's stories and their journeys.
Yeah. So, I mean, in a very real sense, like out saving lives, that's pretty good. Like, that's why you went into it, right? I mean,
you're giving me chills. No, absolutely.
No, it's true. It's true.
To be able to have these conversations with the patients, at the end of the day, like you feel like you've done something, and it's incredible.
Yeah, no, you absolutely have. It helps put your head on the pillow at night and maybe get a little bit of sleep in a good way. And you mentioned something else earlier, which I think is probably worth mentioning or at least emphasizing, which is this idea that over in the EU. So, I mean, Let's Get Checked has a really broad reach now. Obviously, the presence here in North America and specifically in the U.S. is a big presence, and growing every day, and is super exciting. But obviously a company that first started in Ireland, so we're throughout Ireland and the UK and mainland Europe and Canada. So the breadth of that customer base and the ability to affect lives in a lot of different places is pretty awesome. It's
incredible. And we're working with health insurance companies, and we're reaching out to members that wouldn't necessarily know. They're not even technical savvy. They wouldn't necessarily know that we were around, and now we're reaching out. So we have such a big outreach and the amount of tests that we're offering to people in screening tests, something that they necessarily wouldn't do.
The STD screening world too, there is that idea of health promotion, making sure that you're participating in safe behaviors. I mean, I think about some of the HIV testing and syphilis testing and stuff that we offer that can probably also, not only be, it's not preventative, you're not preventing these things, but what it certainly does is if somebody has one of these infections and is otherwise without symptoms, by detecting it, you're certainly preventing the spread to others. And so, and also getting that person on, hopefully on therapy, treatment, which should be fairly straightforward early, to decrease the downstream effects from all of that.
Exactly. And I like to think, I hope that we're also taking away the stigma. It's extremely important to be doing sexual health screenings. If you're a sexually active adult, most of us are, you want to make sure that you're doing your screenings as necessary, and not feeling like this is something that you need to go out to a clinic. You can do it in the convenience of your home. It's anonymous service, but it's extremely important to do your screening tests.
Yeah, exactly. Anonymity of our test, meaning no one knows that you're taking it because you're collecting it yourself. Convenience, it's coming to your home. And then I think particularly in the era of COVID, the safety of it all, because again, you're doing it in your home. You're not having to go to a brick and mortar a clinic or a doctor's office, a hospital, waiting in a lobby, packed with other people. All of those things are really favorable and positive. Thanks for your time. Great information. And again, a personal thank you for being my colleague. It's awesome to
Absolutely.
have you on.
Thank you for having me. I'm extremely thankful for the clinical team that we have. We have some really incredible people on our team. So
Amen. All right, Kristen, enjoy the rest of your day.
thanks.